Doctor, one of the things that you've talked about, I know, is the relationship between um, mother's diet and what that can do to her offspring 10, 20 plus years down the road. Can you talk a little bit about more about what you mean there?
Well, I think that that's an interesting question, and for me it was particularly important because I was dealing with children, and so I saw a lot of mothers and young mothers, and they always asked me, was what they ate when they were pregnant important? And many years ago, if you'd asked a doctor that, say 20 or 30 or 40 years ago, the doctor would have said, well, here's the baby, here's the mom, and the placenta is in between them, and that's what regulates in a mother's circulation the compounds that go into the baby's circulation. So it's kind of like the policing system. So whatever the mother ate, the baby would be okay. We now know that that's clearly not the case, and it's not the case specifically during very specific periods of the pregnancy. And let me explain. We're in the womb for 9 months, and we develop from a fetus to a young baby and a growing baby. And during that developmental period, there are epochs or time periods that we call critical periods. And during those critical periods, depending upon what the baby is being exposed to nutritionally from the mother's circulation, it sets how the baby's metabolism is going to respond after birth. So during these critical periods, for example, if the mother is eating too many calories or too much sugar, the body will say, well, that's what I'm going to get when I'm born. Better be ready for it. So it programs the baby to eat more and to store more fat. So what that means is that child, when born, will be a fatter baby, will be a heavier adult, and will tend to have a higher incidence of cholesterol problems, high blood pressure, and diabetes. So what a mom eats during these critical periods in pregnancy can affect the baby's health acutely and even 50 years down the line.
Can you talk a little bit more about that and in those stages? Should a mother change her diet throughout pregnancy, or are there certain things that she needs to get at certain times of the pregnancy?
Well, I think there are nutrients that are needed throughout the pregnancy, but from my perspective, when you're growing a baby, you're basically growing a baby's brain. Because if you look at a baby, the baby's head is really big compared to the body. And that's even more true earlier on in the pregnancy. So I think getting brain healthy nutrients, especially the omega-3 fats, is critical. But I think in most American culture, we get many nutrients. We actually eat abundant nutrients. So I think what's more important is having the mother exercise during pregnancy, and that can be done throughout pregnancy, and have the mother watch her weight gain so she doesn't gain too much weight. And the third thing is to try to eat healthy foods, meaning shop around the periphery of the grocery store. Don't eat a lot of packaged foods that are broken down into sugar rapidly, because that goes across the placenta, and those are the bad signals that can program adverse health outcomes in a baby.
What about the fish for pregnant women? We're cautioned a lot because of mercury in particular. Is that still a safe product for mothers, or is that where supplements may come in?
Well, I think according to the government, we're not at the point yet where women have to worry about heavy metal toxicity if they eat 2 servings of salmon or cold water fish a week. But I'm not sure if that's accurate. I don't think the answer's in. In that circumstance, supplementation with omega-3 fats is a valuable option.